All right, so the big blue vein is called the what?
Superior Vena Cava.
This is the superior vena cava, and from the superior vena cava, there's going to be one small branch coming off of it, and it's going to stick straight up into the sternum. And just like with the arteries, okay, it has a very similar name. It's called the common trunk of internal thoracic vein. The common trunk of internal thoracic vein. Then the superior vena cava is going to have these two bigger branches. You don't have to know the left from the right. But once this branching occurs right here, it's called the brachiocephalic vein. Brachiocephalic vein. The brachiocephalic is going to have three branches itself. The first branch is shooting straight back into the vertebrae, and this is the longest name we have to know. It's called the common trunk of vertebral and costocervical vein. Okay. The third branch is going into the left side of the arm. Okay, in this case, and before it exits the thoracic region, it's called the subclavian vein. Once it exits the thoracic region, okay, it changes names to axillary vein, and you will notice that there's another branch from the axillary vein. There's a branch coming off, okay, and it's going into the scapula, and just like with the arteries, it's called the subclavian vein, okay. But unlike with the arteries, there's not a clear-cut portion as to where the axillary ends and brachial begins. So on the exam, if we're asking you on the outside of the thoracic region, but really close to the armpit, you would say axillary. But if we ask you really far down the arm, you would say brachial vein. Does that make sense? Okay. The third branch and the final branch this is called the internal jugular vein. The internal jugular vein, once it exits the body, okay, once it exits the muscle, it's going to be called the external jugular vein. Okay, the external jugular vein is going to split twice. Okay, the one more medial portion of the vessel is called the anterior facial vein, and the more lateral vessel is called the posterior facial vein. Okay. Then the two sides of the external jugular veins are connected through the transverse jugular vein. Okay? And then from the internal jugular vein, there's going to be a vessel that's branching off and going into the scapula, and that's called the transverse scapular vein. Okay? The last thing that you have to know is that if you lift the right side of the lungs up, Brittany, can you hold that back? Okay. There's a hook-like vessel right here. That's called the azygous vein. The azygous vein is going to branch and feed each one of the little vessels that's going to through the ribs, and those are called the intercostal veins. Okay? Good? All right. The last vessel you have to know, if you lift the heart up, this big blue vessel right here is called the what? Inferior vena cava. Very good. Ta-da!